All right. Well, yeah, today we have a presenter from FindHelp. I know many of you are familiar with FindHelp, use it to find resources and maybe to get referrals to your programs. It used to be known as Aunt Bertha. I don't think we call it Aunt Bertha at all anymore, right? It's just FindHelp now.
Yep.
But we have with us today Kelly Ross, who's a community engagement manager with FindHelp. And thank you so much, Kelly, for joining us to explain the way that the tool works in terms of getting referrals and in terms of finding resources for clients and helping families that you work with to get connected to what they need. I don't know if there's anything else you want to say to introduce yourself, Kelly, but I think we can really just hand it over here. I guess before we start, I should say, please, if you're an outreach specialist with Welcome Baby, if you could just sign in, put your name in the chat, just for attendance purposes, that would be great. And yeah, I'll go ahead and turn it over to you, Kelly. Thank you again for being here.
Great. Just getting my screen set up here. Make sure I'm sharing the right screen. 1 second.
Sure thing.
Okay. Hopefully everyone can see my screen, my slide deck here. Great. Thanks. First off, thanks, Steve, for the introduction. I appreciate just having the time today to be part of this meeting and present a little bit about FindHelp. Like Steve said, I'm sure some of you already use it or are familiar, maybe you're not. So hopefully this won't be too much of a repeat of information you already know, but I'm hoping to really not get too into the weeds, but really answer any questions and give a high level kind of demo training on how to find resources, how to manage referrals, and how to use some of the tools and features that are free and available for community-based organizations to use. So I will be looking in the chat, but feel free to, I think, unless Steve, you don't mind if we keep questions open throughout the presentation, I can either answer those, and I'll also take breaks so we can kind of answer some of those questions as well. So like Steve said, my name is Kelly Ross. I'm a community engagement manager with FindHelp in California. So what that means is I support the community-based organizations that utilize the platform and the customers that we work with that are various hospitals or health systems or education systems, et cetera, that also utilize the system for referrals. And so really, in a nutshell, my role is to support organizations using the platform and tools, implementing that into their work. That's a big part of what I do. So what I'll be going over today is just an overview of what is findhelp.org, how to use it, so search and refer, claim your program, how to access some of the free tools and features that you can use and that I know CBOs utilize in their everyday work. And I'll do a live demonstration, but I'm just going to go through a few slides here prior for those of you who aren't as familiar with FindHelp. So FindHelp, first I always like to mention our mission, which is to connect all people in need and the programs that serve them, and to do that with dignity and ease. We believe, this is important because we believe everyone deserves ease of access to programs and the dignity of a response to request for assistance. So we also know this can be challenging. I myself worked in various roles at nonprofits prior to this position, and know that can be difficult. So updating resources, keeping, e-directories and other things up to date. And so really we want to ultimately want to make it easier for people to navigate the system, find resources and services. So we know it can be hard, obviously, to navigate the system. You all know this, and we're trying to solve that problem. This is just one of the ways. So this is a problem you all know very well. There's an individual searching for resources, and there's tons of dedicated programs, but the process can look a lot like this. So we're trying to solve that by allowing individuals or those helping them navigate to search in their zip code, browse available programs in that zip code, and then directly connect those to those programs through our platform. And then in addition to that, we also want to ensure that those connections receive a response. And we'll talk a little bit more about that later when I'm in the live demo. So like I said, hopefully you know a little bit already about the site, and I know Steve sent out some additional documents. You maybe were able to look at some of those PDFs, but a couple just key things to note. FindHelp is the largest online search and referral network. We only list free or reduced cost services. So those can be anything from medical care, food, housing, employment services, etc. So the platform is really free for people to use that are looking for help or for organizations to manage their programs. And the idea is that it's a one-stop shop of services where you put in a zip code, you find what you need or that someone you're helping needs, and then can be connected to those. Then the ability to look to see if that person, got help, got the help that they needed. And again, I'll kind of get into that in a little bit. We were founded in 2010, like Steve said, originally Aunt Bertha. We started by just listing social services that people could find and connect with. The site is accessible to anyone nationwide. We have over 100 language options for people to translate, whether they're initially translating the page when they're searching for resources, or translation when they're sending a resource to an individual. All of the programs, like I said, that are listed are free and reduced cost programs, and those include national, state, and local programs that serve a particular area. I can confidently say, I believe now we're at over 1,700 programs in every county in the US, but particularly in counties like Los Angeles County, I think we have around 4,000 or 5,000 programs listed on the platform. So it depends on the county, but in every county we have at least 1,500 or 1,700 programs listed for folks. A few things about the benefits that make it unique. So we are an open network, meaning we don't require community-based organizations to sign contracts, and anyone can use it at any time, like I said, anonymously, or if they have an account. Privacy and security are extremely important to us. So we do everything we can to protect data and privacy. We're HIPAA compliant and high trust certified. And then also flexibility. So we pride ourselves in the tool being easy to use, that people have access to all resources on the platform without creating an account. There's free tools for community-based organizations to use, and there's no obligations, on how people can use that. So it's really intended to support people. I'm going to pause there while I hop into the demo site. And so if there are any questions, I haven't seen any in the chat, but let me know if anyone has any questions. Okay. Okay, great. Again, feel free to ask questions as I kind of go through this live demo. So now I've just gone onto the findhelp.org site, and this is our homepage. This again is just the page where if you went to the site, you would come to this page immediately. I'm not logged in at this point, so this is just an anonymous search. So what I'm going to show you is what it looks like to just anonymously search for a resource for, again, yourself or someone that you're supporting, and kind of some features and things that you can utilize when going through this process. So I'm going to put on kind of my navigator or seeker hat here. First, I want to point out the language translation option in the lower left-hand corner. That's where you can translate the site. So you can do that here, and then I'll show you the other locations that you can translate as well. Other things to point out are if there's some other things on the bottom right-hand side of the screen, such as suggesting programs be added to the platform, which a lot of people do, which would be an example would be, you know, of an organization or a program that you don't find on the platform. You can suggest that it's added to the platform. It's a pretty easy way to just do that. You just complete a few fields. It'll do a little back-end search, and then it'll prompt you to add maybe a few more pieces of information, and that goes to our curation team, and they kind of do all the hard work. They verify that a program is in fact still accepting, you know, it's still open, that the program is still active. They verify a phone number, an email. So they verify a few things on the back end. And as long as they see that that's still up to date, they will add it to the platform. But now I'm going to just show you what it looks like to navigate. So I'm going to just put in a zip code. So this could be, again, where you're located or the individual that you're helping is located. And then I'll click search. And that's where you're brought to a page, and it says that there are over almost 5,800 programs serving people that are in this zip code. And that's national, state, and local programs. So from here, what you can do is a few different things to search for a particular program or in a particular area. You can either go up top and look at these domains, categories, and then within those, look at the subcategories. So emergency food, food delivery, food pantry, let's just use that as an example. And you could click on food pantry, and what happens is a list is populated of programs and community-based organizations that have food pantry or something, you know, food pantry locator for the Los Angeles Regional Food Bank, mobile food pantries, etc. So you can search that way. You can also go to the top and put in a keyword, or a program name, or organization name. So I could put in, let's see, Seeds of Hope is one organization that we work with, and that will come up and it will show me the food distribution and program for Seeds of Hope. So you can do it two different ways if you're searching for resources. So a couple things I want to highlight here. One is filters. So after you're brought to this page, you can kind of drill down and filter these results. So, and these are dynamic, meaning whichever category, subcategory you're searching in, these will change. So I could search for, you know, if something was specific to seniors or homeless, etc., and then filter that search. that way. You can also filter it by the program. So you may want to just look at free programs instead of reduced cost. And you may want to make sure they are open on weekends, etc. There's also the option to filter based on language if someone is indicated at that organization or program that they speak a language other than, English. So these will also be dynamic depending on the results. And then lastly, just income eligibility, which will just filter out some additional resources. But so some things I like to point out too for community-based organizations that are supporting seekers and or looking for resources on the platform are this save feature. So if you have an account and you're logged in, which I'm not right now, but I'm going to go ahead and do that just to show you how this works. I'll log into my demo account. And I know that I'm logged in because now my name is in the top right-hand corner and I have some other options here that are available to me with my account. But if I am looking through this list of food pantries and, you've got 111 results here. So I want to kind of save some of these. I want to narrow some of this down, or maybe I want to share this with an individual. I could either save individual resources. So by clicking on save, and then I can save it in a folder. So I could say nutrition, and I could save it there. Or I could create a new folder and call it something else, whatever that might be. So you can save those resources again in folders. And then you can also share those. So you can share that with the person, again, that you're helping, whether they're in person or whether they're, you want to email that to them or send a text to them. So what that looks like is if it's an email, you would just put in your phone number, a message. And then again, this is where you can change the language for the recipient. So that person speaks different language, you can translate that here, and then they'll get an email that you've shared the resource with them. You can also send it via text to their phone number. It'll just put your name and then their phone number, and again, that language preference, and then you can send that. You can also share a resource on Facebook. So this will just share a specific resource if you want to highlight that. In addition, there are, when you click on the more info for a particular program, there is additional information about eligibility, about their website, or where to go to access their website, locations, which county or counties or areas a program covers. So that'll all be kind of listed in that more information dropdown. And then I know that this program in particular and this organization is managing this information that's listed. And I know that because they've got a check mark in the right-hand corner here, which is what we refer to as claim. They've claimed their program. I'm sure many of you, if you have programs on the platform, have claimed your program or are familiar. So what that just means is they've taken ownership of that listing, they're updating that information, or potentially accepting referrals through the platform. And I'll kind of go over claiming in a minute. The other thing is the next step. So this is how they as in the CBO has chosen for people to connect with them through the platform. So in the case of the Los Angeles Regional Food Bank, because it is a large food bank and it's not easy to send direct referrals. They just have see next steps. That just need, and what'll happen when you click that is it'll bring up either a phone number or just say best way to connect is go to their website or call them. But if an organization does have referrals turned on, such as this program right here, it'll say refer. And that's where you would click on refer, and then you would complete the fields here. So whether it was for yourself or your family or someone else. And you would just put in your name, their name, email, phone number, again, that language preference for the individual, and then the best way to reach them, and most importantly, the confirmed consent that you have consent to send a referral on behalf of that individual. You can also write comments here. So this is just a comment that's only visible, as it says, to you, your team, and then the agency that you're sending the referral to. But once, I'm not going to send this because they will receive this referral and I don't want them to receive a bad referral, but you would just send that through and the organization would receive that referral for that individual. Also something to note, when that referral is sent, the agents or the CBO gets the notification that they've received a referral. You would get a notification that you sent, the referral was sent, and then the individual in which you sent the referral on behalf of will also get a notification. And I'm going to pause there and just see if there are any questions.
Did have just one in the chat, Kelly, that was just asking about resources in Kern County.
Okay, yeah, I certainly could put in a zip code. We have resources in every county, but I don't know Kern County's zip code, but happy to put that in. Got one for me.
You have one, Sylvia?
Okay, can you hear me now?
Sure.
Yeah.
Okay, I think it's 935 06.
All right, let's try it.
Yeah, 935. Oh, 60. Sorry.
Oh,
60.
okay. 93560.
Yes.
Okay. Okay. So if that's the correct zip, it shows 2,414 programs serving people in that area.
Perfect. Because I get quite a few people from Kern County.
Okay, great. Yeah. Yeah, and so again, same process, we go up and just navigate to one of these categories and choose. I always like to point this out because there's categories and subcategories. They'll just filter down more, so you can always keep it general. It's just sometimes there's, health education has 359. So sometimes it can be really helpful, like parenting education. We can just drill down that and see what resources are available.
Oh, this is wonderful. Thank you so much.
Yeah. And one other thing, so I had just shared with you all that the option to share that via email or text. You can also bulk share. So if you're looking at this and you're like, okay, I just want to send them, the top however many you want to send, you could just choose however many resources, programs you'd like to send. It'll generate a cart, basically. And it'll show you the programs you've selected. And then again, gives you that option to save those to your account, like to a folder in your account, to email those to an individual. Or again, if you're with that person, you can print them. So there's always an option to print or email or save.
Thank you.
I'm going to clear this. So that is kind of what it looks like for a navigator seeker. Now I want to just show you kind of what it looks like on the other end of things. So when you're the community-based organization and you've received that referral, you would get a notification that you have a referral for a particular program that would come to your email. It would say you've received a referral for, and just the name of the individual and their contact information. And you'd also know who sent that referral on behalf of that person. At that point, you get that referral, and what community-based organizations can do is there's a link in that email that'll bring them to their account and FindHelp, and it'll bring them to their inbound referral dashboard. And that's what this looks like. If you remember, I wasn't logged in earlier, so I was anonymously searching. Now I'm logged in, and because I have a program that I'm accepting referrals for on the site, you'll see this My Program Tools and an inbound referral dashboard. And so that's where you can click on the inbound referral dashboard. And if you're an organization that has programs listed, those would be all listed here on the left. So you could choose, okay, I know that I just received a referral for the Employment Training Services program. Go into that program in particular, and then you'll see all of the referrals that have come in for that program. This is my demo account, so these aren't real people, just in case anyone was worried. But this is the name of the person that's being referred, their contact information, their language preference, how they prefer to be contacted, who sent the referral, when they sent it, and then over here is the status update on those referrals. So earlier I mentioned in the beginning of the presentation that you know, our mission and connecting people and having the dignity of receiving a response or knowing that somebody got help. And that's really where this happens. So this is where we always emphasize that people update the status of a referral, so that if someone sends, say from a hospital or clinic, sends a referral to a particular program on behalf of someone, that program, you know, people that are managing that program and managing those referrals will update the status so that you know, care coordinator or case manager, whomever it might be, can see in their record that when they sent that referral, that person got help. And that might be got help. It also might be that they, you know, were referred elsewhere, or, you know, they couldn't contact. But just closing the loop on those referrals to make sure, again, that people got help. And so that way, not only can, you know, the community-based organization that received the referral can kind of track that and manage it that way, but also the you know, person that's referring someone or referring people to programs can also see that on their end. They can see that someone has gotten help. And I'm going to show you kind of where you can see that. So if we're taking this example of Chris Seeker, we can go into Chris Seeker's profile. And then once you're in the profile of that individual, you'll see some basic information. You can also assign, if people are managing referrals in the platform, they can assign those to themselves. There's lots of different ways in which, not lots, but there are a few different ways people can manage referrals too, as like a team in the site. But once you're in that profile, you'll see on the right-hand side, the navigation history. So this would be any referrals that came in to your program for that individual. And it would also be referrals that you've made on behalf of that individual. So it would be the navigation history would be kind of listed here. And some things I'll highlight about that is you'll see the date and status updates of those. So again, using an example that a care coordinator referred someone to a program, then you'll see that that status update was, or that status of that referral was updated to Got Help by whether it's the CVO or the care coordinator, say at the hospital or clinic. So it just gives kind of information and updates that the person managing the referral can see, as well as the person who referred them. So this is just kind of a list of that referral. And you can also start a referral for that individual. So maybe you want to refer them elsewhere, or maybe you've talked to them and you've discovered that they actually also need transportation assistance or resources for housing, etc. You can start a referral for that individual right in their profile by clicking Start Referral. And what that'll do is just show that you're currently helping that person. You would put in their zip code and again, search. And what that does is just it auto-populates to when you're sending a referral. So any information, it'll auto-populate. But then when you're done, you can end the session and start over. I'm going to pause there and just check to see. Oh, it looks like I do have a few questions. Apologies. Would resources that have been claimed be considered more up to date than those that haven't been? How often are resources update? Can agencies' programs be flagged? Yes, great question. So the first part of that question is, would resources that have been claimed be considered more up to date than those that haven't been? Yes and no. So we have a curation team that updates, and I'm just going to go back real quick here to listings so I can show you. We have a curation team at FindHelp that updates the listings twice a year. So they're constantly adding programs and then reviewing programs that are already listed on the platform. And what they do is they don't review, they can't go through every one and make sure every piece of information is correct. But what they do verify is that there is still an active phone number, website, way for someone to connect with that program. Because again, that's the most important, is that someone who is just, navigating and looking would be able to somehow connect to that program. So they make sure at least that information is up to date. So either the program's updating it themselves or our curation team is updating it. Again, they do that every 6 months, so that's twice a year. And then just to kind of answer the second part of the question, if you're someone who doesn't work for, say, this agency, but you're very familiar with it, and that or you've called and that there's information that's out of date, you can actually suggest a change right here on their program card. So that's what this suggest is. And you click on that and it says, let us know about any missing or out of date information. And you can just write a message here and send it to our curation team. So again, they'll get it. They'll review that change, they'll verify that, and then they'll make the change. So those are a couple different ways. I guess there's really, 3 different ways information's updated. People make suggested changes. The organization itself makes those changes to the program listings and program cards, or a curation team does. I see another question here. What is the section to look for assistance with enrolling and Medi-Cal? The section to look for assistance. Maria, could you elaborate? Was there a drop down you saw, or could you elaborate on that for me?
Sure. Yes, if somebody has lost a job, lost their insurance, and they want to see if they qualify for one of the government insurance programs, such as Medi-Cal or Cover California, but basically my question is for Medi-Cal. So I know you have sections for healthcare, transportation, and I'm just trying to imagine which section would we click for the client to find places where they can get assistance.
I'm wondering, yeah, that's a good question. I'm wondering if, like, with health insurance and help pay for health insurance, maybe there's a filter. So these would be particular programs that I guess would help, because if I'm understanding the question correctly, Maria, be like how, connecting them with someone that can help them navigate that.
Right.
Yeah, and I think it would be particular to like a program, like if you know of a program that does that. A lot of times, like in the eligibility, it might state like something around like, insurance or Medi-Cal or something like that. But I'm trying to think if there's another way for you to, like there's underinsured and uninsured filters, but you might want to just try like throwing in a keyword or, doing a search up here in the left-hand side. That's a great question. Let me think on that, and I can always get
That's
back.
fine. You can follow up later.
Okay, thanks.
Thank
Maria.
you.
Yeah. Okay, so now I want to get to kind of the referral process, and then some of the tools that are available for community-based organizations that have programs listed on the platform, because there's a lot of free tools and things that people utilize. So I'd like to show you those. But of course, if there's anything that someone would has a request for me to show, we've got about 20 minutes left, so I'll make sure to leave some time here so I can answer any questions and demonstrate any other like features. So to show, go ahead. I see your hand raised.
Okay, so the question is, if there's a referral that we put in, do we have to close the referral, or is that their responsibility?
Oh, so if you send a referral on behalf of someone?
Right. And let's say that I got a notification that they received the help, or maybe they, bowed out or whatever. Do I have to close that referral, or is that?
So, really it can be updated by either you or the organization that you sent the referral to. Ideally, and I think it's fair to say that majority of the time it's the the community-based organization or agency that's receiving the referral, I think that's where most of the time, that's where the status updates happen. That said, I know that some people say you sent a referral on behalf of this individual, Randy, and you sent it and you just happened to talk to them or were meeting with them again or whatever it might be, and you knew that they'd received help from this healthcare clinic that you sent them to, you could update it as well. But I think that it's fair to say that the majority of organizations I work with that get referrals, they update that status themselves. But
Okay.
it is really open to either. So it's not a requirement that they update the status. We keep it so that either party can update that status.
Okay, and it's mandatory within a certain amount of time or no?
No, it's not mandatory at all.
Okay.
Yep, so it's not mandatory that people update statuses. I think, you know, when we're working with some of the customers that I work with, like for instance, I work with LA Care Health Plan. They maybe want to have a partnership with a particular organization, and so we develop kind of a trusted, we call it a trusted network partnership or trusted network partner, where, you know, we meet with that update statuses. So that might be an example of when, you know, but again, it's not mandatory unless there's, you know, say they're incentivizing that organization to update statuses or something like that.
Okay,
Um,
well, thank you.
yeah.
That's good stuff.
Yeah, good.
Thank you.
You're welcome.
Can I just ask real quick, Kelly, you mentioned customer, LA Care as a customer. Can you talk a little bit about the difference between that status of being a customer versus just a CBO that has listings and is able to use the platform for free?
Yeah, yes, absolutely. So being a customer, what that essentially means is, and let's again just use LA Care as an example. They have their own branded platform. It looks just like this, except you'd see right here. In fact, they have a community site that you can go to. I think it's communitylink.lacare. So I can't remember the whole link, but it looks just like this. And it has their logo in the left-hand corner. And essentially it's the same functionality. If you put in the zip code, you're gonna find the same programs as, you know, you're gonna find the same programs if you went to that site or whether you went to this FindHelp site that I'm on right now, because the idea at FindHelp is that we take a no wrong door approach, meaning we don't hide resources and programs from people. So whether they enter through the LA Cares community site or whether they enter through Cedar Sinai's community site or just the general FindHelp site, they're going to find the same resources. And so they pay to have not only community sites available for their community or members, but they also have staff sites. And so that's something that's internal, that staff then can send referrals to organizations that are listed on the platform. And oftentimes they want to send direct referrals and they do want to see those status updates. So yeah, does that kind of give you, that's without getting too much into the weeds,
No, that's
essentially
great.
they pay to have a branded platform, and we work with them ongoing to implement that and onboard community-based organizations, etc.
That's helpful. Yeah, thank you. Can I just do one more quickie? I know you've got more to cover, but when it comes to listing the results, when somebody does a search, how is the determined, like what shows up on top? Is it by geographic proximity or are there other factors, or even like, I'm just kind of thinking about almost like search engine optimization, you know, can organizations put certain keywords in that would help them be found, or I don't know.
Yeah. Yeah, well, it's, you know, and this wouldn't, you know, and I'm not an expert on the search engine, like how the results are ultimately like populated, but I will mention and highlight a couple things. So, because I was looking to Steve after we talked about the Welcome Baby like programs and other programs. And so I just did a little kind of looking, and when I put in baby, I found it eventually. I just scrolled down a little bit. Oh, hold on, there we go. But there's a couple different ways I think that it's kind of populated, that the results are populated. And it is based on, again, your zip code, right, that you put in. Also if you put in like a search word, it's likely going to pull anything that has like that word, or the organization has that word in. So this one has like the program has baby in it and the organization. Also, it might pull forward any that have like referrals turned on, or that are claimed. And then it'll look at to the services and who they're serving. So this is where, if you have a program, I always really emphasize to organizations to make sure that they, because organizations can update this information on their own, and choosing kind of which tags is what we refer to it as, which tags are listed here. And that'll really also help bring programs up higher in like the search results. So it's kind of a combination of a bunch of different things that kind of, you know, brings, you know, you've got 380 programs here. And then of course someone could filter, but if we're just, is that helpful?
That is, yeah, thanks. Yeah, I just wasn't sure how that worked, but it sounds like it's important to include tags and to just kind of be mindful of what kind of keywords are in the descriptions and that kind of thing.
Yeah, exactly. And again, that's why we always point out too, if people can, you know, choose a category and then a subcategory, right? So kind of drilling down a little bit, that's also helpful. It will, you know, not give you as many results, but instead of 1,000 under health education in Los Angeles County, it's gonna, you know, drill down to however many. And then of course there's that filtering option. In the near future, we will have the option to, and I noticed Melina's comment in the chat, in the future, we'll be able to not only do zip code, but by exact location. So say I could put in my exact address, and then it will pull resources, you know, especially if they're like food pantry, or, you know, people need access to these resources they don't have transportation to. So in the future, we'll have that kind of exact location based search.
Great, thanks.
That was clean. Yeah. And
I
then,
see
oh,
Melina
Melina's out.
Oh, sorry. I was just gonna say, I see Melina had her hand up there too. And now it's down, I think.
Yes,
Okay.
yes. Thank you,
Okay.
Steve. Sorry, just I know that you were speaking, Steve, it just kind of prompted me to I know when we search for Welcome Baby specifically, you know, all the different programs show up. Some are, you know, specific to agencies or specific to hospitals. Is the idea for each individual agency and program to kind of manage and claim, to use your language, Kelly?
Yeah.
and claim our program so that, and potentially can we accept referrals and utilize, all the functionality. What a great resource. I definitely am guilty of underutilizing it. This is so helpful. It just reminds me to use it more. We get a lot of requests, not just from our clients, but people calling our agency for support that are, within sometimes outside of LA County. So this is super helpful.
Oh, great. Yeah. And so, Melina, are you with one of these particular?
Yes. California, Welcome Baby California Hospital.
Oh, it would be under California Hospital. Because a lot of these are already claimed. There we go. California Hospital Medical Center. So it looks like it's claimed and there are referrals turned on. So maybe someone from your team is managing those. I don't know.
Actually, that's us. I have to confess. Yeah, it's LAVBN is behind this. We set these up for you all, and that's actually one of my questions too, is just to see about management, if we can give access separately, because since we set these up, can we also allow the outreach specialists or others to jump in and make updates as they wish to?
Yeah, absolutely. And maybe that's something, Steve, we'll have to talk about offline, just because I'm looking at the time, but I'm just going to show you a few things that I was going to get to anyway, and this might answer some of your questions.
Okay, great.
So when we're talking about managing like your program on the platform, so say this is your program, Welcome Baby, you're with El Nido Family Centers, you claim the program, someone hasn't claimed this yet, but say you claim the program, you'll see you have all of these program tools show up, and one of them is edit program listings. And I'm happy to work with anyone on this call outside of this meeting too, because this can sometimes, there's a lot more that I could kind of get into with this, depending on like your workflow, and if you'd like to have a screener attached to the referrals that come in, etc. But when you go to edit program listings, it'll show any of the programs that are listed for that organization that you've claimed. And this is just my demo account. So I'm just showing you, and this is where you can edit any of the program information. So if you want to update the phone number, you want to update the website, you want to let people know that you have a wait list, you're near capacity, you're out of funding, or you're available for new clients. You want to let them know about the description. This is where also you would update those tags I was referring to. These can be like, there's already populated options, so people can just go through and tag those, who you serve, etc. And then you can also update and change how people connect with the program. So that's in the contact settings portion of and what this is it says connecting with, and then say Welcome Baby. This is where you would determine how you want people to connect with you, whether you want them to just be able to send you a direct referral with their name and email or phone number, or you want them to fill out maybe a eligibility screener. That could be like 3 questions, it could be 10 questions, and that'll come in with the referral. I have organizations I work with that use that to triage referrals. So, okay, they live in this zip code, they meet these 3 or 4 requirements, or if I can now triage that and have someone reach out to that individual. You can also link it to like an existing application or form, and then you would put in the name of the individuals that should receive that notification. So to your point, Steve, earlier you were saying or someone, I think it was you, Steve, if it could go to multiple people. So if each one of the Welcome Baby programs wanted to have different people that are accepting those inbound referrals that are coming in, we would just put those emails here. So there's just a few things we would do on the back end, so that individuals with each program could receive those referrals and or update information that's listed for those programs. And then the other thing I'll point out is you can customize that screener that I mentioned. So if people want to use a screener to, again, gather information, there's an option to do that here as well. And so that's how you kind of change that information for on the back end is, again, edit program listings. A couple other things I want to mention is you can also be on a team on the site. So that just means it's you and maybe 2 other coworkers. You all are on a team so that you can see who's managing particular, who's managing all the referrals for that program. So it's not just one person. It's, say, again, 2, 3 people that can just see status updates. They can see that someone's reached out to an individual, that they've helped them, etc. So that's another feature. And then lastly, I'll point out is program analytics. These are free to community-based organizations that are using the platform that have programs. What I love about this is that this can be really helpful for community-based organizations to show impact in their communities, or just to use internally. So one that I'll point out, a couple I'll point out, is search trends in your coverage area. This is just going to be general information about your program's geographic area. So search trends, common search terms. But then this one shows information and how people are interacting with your program. So I'm going to go to view report and just give you a snippet. And I know it's 1:30, so I will stop after this and ask any question or open it up to questions.
And Kelly, we actually do have 90 minutes total scheduled for this. I don't know if you're available to stick around. But,
Perfect. Yeah. Mhm.
Okay, great.
Sorry.
No, I'm sorry. I should have made that clear. Thank you.
That's okay. So this is the just one example of a report. It's loading right now, but I'm going to kind of walk through what this all means. One is shows just, and this is specific to a program. So let's use Welcome Baby California Medical Center. Would gather data for information regarding that program card in regard to you can filter this by date. So if you want to look at for like the current month, etc., you can filter that, but it'll just pull how many people or how much, it showed up in a search, people interacted with the program, they connected with the program. It'll show if there were how many referrals that came in for the program. And then this is what people look at most often, I'd say. Just again, depending on how you're using this information, but current referral statuses. So this will show that there's 54 unique seekers referred to the program, and that there were 64 closed loop referrals. And I can explain more if people have questions. And then 31 of those got help. So really 54 unique seekers and 31 had the status update of got help. It says 64 because statuses can change. So you can, maybe you say someone's not eligible and then you realize they are eligible and you update it to referred elsewhere or couldn't contact. So that's why this number is more, but this just shows kind of a breakdown of all those referrals for your particular program or programs that you have listed on the platform. And then it'll just show status updates, whether they were done by your organization or by the navigator. Those also can be done by a seeker. I see that rarely happen, but it can be done. And then where those searches are coming from. So top 10 counties, cities, and zip codes. And that again can be, you know, just helpful information to inform, you know, oh, we're getting a lot of referrals that are coming from this particular county or city or zip code. You know, maybe there's greater need there, or maybe we need to do more communications to other counties or areas. So again, this is just one of the reports that's available to community-based organizations, again, for free, that's just in their My Analytics. Another report that I won't go into, but I'll just highlight, is the screener dashboard. It'll pull all of the screener information. If you have a screener attached to your referrals, and you can pull that report. You can also download all of these reports into a CSV. So they're really easy to kind of work with and then, you know, manipulate or use for leadership, or again, for grants or whatever might be helpful. I'm going to stop there and just see if there are any questions, or if I can go into any of the things I've highlighted in more detail. Okay. So I wanted to show, so we've reviewed the inbound referrals. We reviewed how to edit any programs that a community-based organization has listed. We looked at my team and program analytics. I wanted to also point out that there's this people I'm helping option once you have an account that'll just show essentially all the people that you're helping, much like the inbound referral dashboard does. But this will show, say, people that you're helping that either they came in through they came in because they were referred to a program of yours, or you were just searching on behalf of that person and sent a referral on behalf of them. This is where you would see that list. So again, just under people I'm helping and people, and you can access that individual's profile like I showed earlier by clicking on their name. You can refer them to another resource or program. And then you can see kind of a quick summary of referrals by clicking on summary. And that'll just show you that navigation history. That's also a place where you can easily update a status. You can add a note. Just view that really quickly, as well as the how to contact them. If you've assigned people to yourself, like you've gone into their profile, you assigned Phil Seeker as an example, you're helping Phil, you can filter over here to show just the folks that you've assigned to you. And then you apply those filters. Looks like I've only assigned Sylvia to myself, but again, that's just a way that a lot of community-based organizations manage to those referrals, especially if it's multiple people that are managing those referrals. Also, I wanted to say that under your name, you'll see options to a few other options. And some of these are just other doorways into, you know, a similar feature or way to see, you know, different doorways to see kind of the same thing. But I had mentioned saved favorites earlier when I was saving some of those programs and resources. I created like that cart and I saved those to a folder. You would find those in your saved favorites. So you go to save favorites, and then you'd see all the programs that are listed that you created. And these are just my personal folders. I created a housing folder, so I would click in there. Looks like I only saved one resource, but this is where, again, easy access to find those resources and then share them, print them, or if you wanted to say remove resources, you could edit that folder as well here. But I see a lot of people use this by just calling them different things and then saving those. You can continue to save and kind of edit what's in your folders. And you can also see those referrals that are specific for you. So I know some people on the call, I don't know everyone obviously that are on the call, but I know some people on the call do work for particular organizations, and you may or may not have programs that are listed on the platform. If you're interested in finding out if you do, you can go to claim programs, which is down here on pretty much any screen. So if you're just on the homepage, you could scroll down to the bottom and go to claim programs and search for your program. If anyone wants to throw out a provider or program name, I can look that up. Otherwise, I'll just do a general search.
Maternal and child health access.
Okay. And it will show me anything, it'll show me anything that matches this. So you can put in a zip code. Should I just put in, sorry, I didn't catch who said that, but is there a specific zip code you want me to put in? Otherwise, I'll just keep it blank. See what we find. Okay, so then it'll show a list of, because I didn't put in a zip code, it's showing things outside of the state. But it'll show anything that's a possible match.
Pretty sure it's the top two. I recognize both of those programs. There are programs.
Oh, okay, great. So this is where if you did a search, I'm going to show you kind of, if you search for your programs, you saw these, you can click on claim if you're the appropriate person to claim these programs. But if you wanted to just view them to see, you know, what does this look like? Just click on the program link and it'll bring you to that program that's listed. So you can kind of review like, oh, this information, you know, obviously it's not claimed, so no one is like managing any of this information that's listed. A question I get a lot is, how is this information listed on the platform? So again, this is our curation team that looks for again, free and reduced cost services that are in communities that can serve people in communities. So they often will pull this information from websites. So I just wanted to note that, because I do get that question of like, where did they get this information? And that's typically where, unless the organization has claimed it and is updating it, that's where it's come from. And then you can click on the organization name. So I'm just going to click on Maternal and Child Health Access. And when you do that, it'll show all of the programs that are listed on the platform. So that's where we see those 2 programs.
Thank you. Thank you. We'll have to follow up. I see our CalFresh program is not listed, or our Welcome Baby program as well. So would different programs, are we able to customize and contact people within different programs within the same agency?
Yeah, you are. Yeah, so say your CalFresh program, you wanted those referrals to go to 2 people in a particular department and be managed by those people, but you wanted the Welcome Baby, which makes sense, right? You wanted the Welcome Baby referrals or information that's listed to be managed by some other people in another department. You would do that again through that like edit program listings. So for the first step is really just claiming those programs. So I'm sorry, I didn't catch who was asking me that question, but you would just click on work here, or back where I was by claiming those programs. And then that'll kind of start the process of being able to kind of update that information and who gets what on the back end.
Thank you. Thank you for going over that.
Yeah, you're welcome.
Just can I follow up on that one a little bit too?
Yeah.
We do have, as we saw, all of the Welcome Baby programs listed and they're claimed by First 5 LA, but is there a way to associate that program or somehow make it show up under this MCHA, like to have because they handle the California Hospital Welcome Baby program. So even though it's a different organization that claims it, is there a way for it to show up like under here?
So we could add it to be listed under Maternal and Child Health Access. I just wouldn't want that to be repetitive. So you can add programs to be listed under your organization, and you can remove programs. So remove is usually pend them, but I won't get into that piece. That's something that I can help support on. But so say First 5 LA said, you know what, we want only 2 programs to be listed under First 5 LA. And we want, this Welcome Baby program to be listed under this organization. You can easily edit and update that in a couple different ways. So you can't change this name. One of the things you can't change, like a CBO can't change, is this organization name. We have to do that at FindHelp. And our team has to do that on the back end. But other than that, this name can be edited. And again, all this information can be edited, and you can easily add programs to the platform by that suggest a program feature. Does that help, Steve?
Yeah, I think so. But there's not really a way to have, like, for example, the Welcome Baby program that's claimed by First 5 LA also be associated with and kind of show up under Child Health Access.
No, that's okay. Yeah, you can do that too. If you want it, you want it to show up in both places.
Exactly. Yeah.
Yeah, you can do that as well. So again, it would just be suggest the only way that that may not work is if they verified, if it was like the same email address, which I'm guessing it's not because they're two different organizations. Because when you put in suggest a program, let's just go through the steps just because we can. I just put in, welcome baby, California. You can put in the website, you don't have to, and it'll do a search. And then it shows all of the possible matches. So here are all of those matches, and it says, does this match what you're looking for? If it doesn't, then you add in more information here. So none of these, you want to add a whole new welcome baby program to be listed, and you want it to be listed under the maternal, is it maternal child health? Sorry, I forgot the full name, but
Yes.
Yeah,
you would list that here and put in the website, city, a little description. So you just put in some basic information, put that you work at the program, and then suggest a program. And then again, our curation team gets it. They verify that. They look at the website, they look at the phone number, make sure again, those are legitimate. And then you'll receive an email that says, here's the program. We've added it to the platform. Usually that takes anywhere from a couple days to at the most a week, but typically it happens within a couple days. So it's pretty easy. So we could do that. You could certainly do that here and add it for that particular organization. And that would be another way, I think, too, that people may be searching for particular organizations or programs. And that would be another way that it would show up for people that are searching.
great. All right. Yeah, thank you.
Yeah. Any other questions? I don't want to, I've already, I really hesitate to overshare during trainings because I know it's a lot of information and I'm moving around a lot and showing a lot of different things. So I hesitate to kind of get too far into the weeds, but I really highlighted a lot of the key things that I know that community-based organizations use and some ways to add programs or use it to manage referrals or send referrals. But anything else I can show or answer for anyone?
Okay, I'm sorry. I was gonna try to let somebody else talk here, but can I just ask one more?
Yeah.
You mentioned a little bit earlier about kind of funneling referrals to another website. Like, I'm just thinking how some of our programs have their own interest forms, their own forms set up. So if they wanted to get a referral directed to that form so that they can, have them go to their own custom form, what does that look like? Or how does that
Yeah. So just to make sure I'm understanding correctly, Steve, so when if someone sends a referral or an organization has a program listed, let's use that. Let's go to, again, I'll just go back to parenting education because I've been going to that today. So you're saying linking here to a form?
Right, like, so they wouldn't necessarily just go through FindHelp and then have the email get sent to alert somebody there. It would take the user, whoever is making the referral, to a separate form, to like a separate website. Like,
Yeah, okay. So I think this is an example of what you're referring to. So some people choose to link like their website or a specific page on their website, right? Like like I know on your, is it the e-directory that you've shared with me or so, where there's then someone has prompted to go through a couple eligibility or questions. So people can link that right here. So instead of sending a direct referral, they click apply on their site. And then it says the best way to connect, and you can change this where it doesn't have a phone number. But in this case, it says call or go to the program's website or apply on their website. And then, whoops, yep, there we go. So then it just, you click on that and then it links, or it immediately brings you to the page where the application is.
Perfect. Yeah, that was exactly what I was talking about. That's
Yeah. And another thing, so you can do that with the programs as well. And you can also, hold on, let me move this out of the way. There we go. So you can do that, by just linking that on the back end. So it'll go to this application. The other thing is a lot of people, if it makes sense, they will take the application questions. And again, everyone's different, so this may or may not make sense for an organization. But they will take those application questions and they will just put them into a screener on the platform so that instead of someone having to jump out and open up another website, that they just complete the questions in the screener that comes, that goes along with that referral. But our screeners don't have like conditional logic. So, if you said yes to a question, it won't then prompt specific questions compared to if you said no, so it doesn't have that conditional logic, but yeah, so you can absolutely do that where it just links to an application on a website or just a website. Another thing I wanted to mention to Steve and to everyone on this call is that you can place we have like a option for community-based organizations to place a simple search box and just embed it on your website so that and that can be put on any website for free. That's not something that, we have kind of documentation that we can provide to help people do that, or if you have someone at your organization that can do that for you, but it's just putting that like search box on the website where someone just has to put in again their zip code, and then it'll launch them into FindHelp. So there's multiple ways in which people can use like a simple search box, or I know I mentioned a QR code or something to link to a program on the platform, or just to search for resources on the platform. I think I see a question here. Can we use a Google form? Does it need to be our agency website? Can we use a Google form for that purpose? Yes, you can. So to answer your question, Melina, if you go again to when you set it up on the back end, you go to edit program listings, like I showed earlier, and you would just go to that contact settings. And the way that you set it up is you choose fill out an existing application, scheduler, or contact form. And then you just link that here. So that's kind of how that's set up on the, so, as an example, if I wanted this healthcare clinic program to directly link to a particular website or form, I would just drop that in here and then indicate what kind of tool that is, and then publish that. So yeah, you would just link that there. Great. And since I'm here, we do have the option for a scheduler. It's a little bit more difficult to set up. So if that's something that you want people to be able to schedule an appointment, that'd be something that you just want to let me or FindHelp, FindHelp support know, and we can help with that. And then there's just visit our website, call or email us. So really the top two are direct referrals. So either just sending that name and contact information, that's all we need to accept a referral for that program. And then these are the folks that should be receiving that referral, or we want them to fill out a screener to go along with that referral. And then again, anyone that should receive that information at your organization. And then again, this can be customized depending on what you want to ask. Okay, anything else I can demonstrate before I just hop over to wrap things up here? I just have a few more slides, but I see I have 1 minute left. So I want to make sure. So just as a kind of wrap up and kind of some next steps, there are some dashboards and analytics that are free for organizations to use, examples of why you would want to use some of these dashboards. And I can send this slide deck or some information to as a follow-up. But just some ideas and ways in which community-based organizations use those analytics that are available, from the search trends to the screener dashboard to the data collection form. And then just some key takeaways is if you do want to access like any of those tools, you first need an account, which is just your name, email, and a password. And then you'd need to claim programs if you had a program that you were to be a claimer on. Again, just meaning taking ownership of that program listing. And set up, select like an intake tool that fits the needs of that program and your organization. And then again, just know that you can kind of interact with any of those programs that are listed by saving them, adding notes, sharing them, referring folks to programs, managing people that are referred to your program. And we went over some of those tools. And then I would just encourage, if you need any help with claiming or have follow-up questions, feel free to reach out to me. I will send some information to Steve to share with the group. Certification, I'm just going to skip over, and then there's me. But again, I'll provide this information so Steve has that and he can share it. Another thing I like to share with folks is we have some short videos that go over a lot of the things I just demonstrated today. So how to claim your program, how to create an account, how to manage referrals, a lot of the different tools that I went over, so I can share that as well. But
Yes, I would like to have the videos.
okay, great. Yeah, it's just a link, and then it has kind of those, again, they're just really short, but they're helpful visuals that people can review.